My name is Jill Hawthorne, pronouns she, her. And I'm class of 87 and Associate Director of Constituent Engagement and Campus Partnerships. And we are grateful to that Dr. Prateek Jindal and Director of Student Health Services for the Claremont Colleges and Sandy Vasquez, Vice President for Student Affairs, are here today to discuss how this central service works in partnership with Pitzer for Student Health and Wellness. I want to make sure that you know that the session will be recorded and we have a half hour for this session, so it will be a little shorter than usual. So with that, I hand it over to our presenters.
Thanks so much. As mentioned, I'm Sandy Vasquez, she, her pronouns. This is my 5th year here at Pitzer, and we're just delighted to be able to welcome you and your students back to campus, and just really grateful for the time of Dr. Jindal here with us today, who will be providing an overview of student health services and care support available to your students.
Hello, everyone. It's nice to be here. My name is Dr. Prateek Jindal. I use he, him pronouns. I'm the Director of Student Health Services here at the Claremont Colleges. And we'll probably just jump right into a quick overview of what student health has to offer for your students, for Pitzer students, and try to see if we can leave plenty of time for questions and answer. Let's start our screen share here. All right. So student health services. So we have physicians as well as nurse practitioners, pharmacists, nurses, medical assistants, receptionists, administrators, basically a whole team to help take care of your student. Our focus is on the students. We're student health services. We don't make appointments to see faculty, staff, family members. However, of course, in our COVID world, we are doing some degree of COVID testing and contact tracing and some of those type of COVID-related services for the campus beyond just students. But as far as appointments, it's just going to be your students. Our main focus is to try and address any health and wellness needs that the students may have. This is our building there. It's the Tranquata Services building, student services at 757. This is a picture in probably pre-COVID times, right in that patio. There's 2 big white tents out there now where we can do a variety of COVID services as well. But nonetheless, that's where student health services is located. Any visits to us are confidential, so they can't be released to anyone without the student's consent. The only exception is if they're posing a danger to them, the students are posing a danger to themselves or to others. And that includes kind of this public health danger with COVID. So, we do release and have campus liaison. So if there's a COVID diagnosis or something, we certainly will liaise with the campus. We don't need specific permission for that. Student health is open for students Monday, Tuesday, Wednesday, and Friday from 8 to 5. On Thursdays, we have a staff meeting in the morning, so we open at 9. So essentially, we're open 8 to 5 every day. We're closed from lunch for lunch from 12 to 1. There's a phone number that you can call to make an appointment. Usually there's no fee, but if there's late arrivals or if you miss your appointment, then there may be a fee. So I have a little slide on that. Services we provide anywhere from, just acute calls and cops and, injuries to physicals and travel physicals, sexual health, contraception, STDs. If there's any need for x-rays, you roll your ankle or something, so extremity chest x-rays. We can perform some in-house labs as well as draw blood work to send out to a laboratory if needed. And then we do have a dispensary. It's not a pharmacy, but we carry some basic common prescriptions that the students may need. So for their convenience, they can choose to get the medicine filled at the dispensary and walk out with it right from student health, rather than having to go into the village or some other part of the city to try to get their prescription, right? For COVID, we are doing routine asymptomatic screening of Pitzer students via saliva PCR testing. That's available Monday through Friday, 7:30 a.m. to 4:30 p.m. We're closed again for lunch from noon to 1. And then if your student does have a symptom, they certainly can seek a consultation with a provider, because again, not everything is just about having a COVID test. It's about taking care of your symptoms, right? Your cough may be due to something else, or your congestion may be due to something else, whatever your fever. So we recommend that you call student health, you have an evaluation with a provider, and then they can decide if you need any kind of testing, including COVID testing. And they have in the clinic actually available also rapid antigen, and they can also get you back out for the saliva PCR testing. So either of those options are available. We have contact tracing for anybody who does test positive to identify their contacts, to notify the contacts, and to follow cases and contacts as needed as per public health. We also help the college with their isolation and quarantine management as far as checking in daily with the students and making sure the colleges know when students can leave isolation and quarantine and when they're cleared to be on campus, when they're not cleared to be on campus. We have been approved, Student Health Services has, to be a COVID-19 vaccine provider. So even this past spring, we were providing vaccines to students that were in the local area, as well as faculty and staff in our community. And we remain committed to continuing that. So if your student is coming to campus and has not yet been vaccinated, we're open. We have appointments today, tomorrow, every day. And we have the J&J single dose vaccine right now, so we can get the students vaccinated and up and running in 2 weeks to be fully vaccinated and then participating fully without restrictions for the fully vaccinated. And if boosters do become indicated, which there's a lot of talk of it becoming available in the near future, we remain committed to providing that to our community as well, including Pitzer students. Fees, so the very first thing up on the top in parentheses is there's absolutely no fees for students to come to student health, okay? So just to come and see a doctor and talk to the doctor and have a doctor's visit, there's absolutely no fee, there's no charge or anything like that. Now, if they take an appointment, they missed the appointment, they took it away from somebody else, there are some missed appointment or late appointment fees. Walk-ins have a fee, but scheduled appointments, there's no fee at all. Some other like pre-employment physicals and study abroad physicals and stuff do have some charges. Now, if it's part of your doctor's visit, they do recommend a urine test or a blood test or something else. There certainly may be fees associated with any tests and procedures that are offered or performed, but the basic office visit has no fee. Students do not have to pay. If they do incur a charge at the time of their visit, they will be made aware what the charges are. They have, I think, like 7 or 14 days or something like that to pay. And after that, it rolls over to their kind of Pitzer student account, and you can make payments there. Students do get a receipt for their services. And so if they have an insurance that's not the student health insurance, they can submit that receipt to your private insurer for out-of-network reimbursement. Student health, I think, plan, all those things we can kind of go over. So really our charges are very minimal if they do exist. Most of the time they will be covered by insurance. You just have to submit for reimbursement, and students really should not have finances be the barrier for them to get care. We have a portal for students, so they can use that to make appointments, to email their doctors, to get their test results, update, review their records and all of those things. So it's a very convenient method for students to use. And that's where any COVID testing results will also reside that were done through our saliva testing. What happens after hours or when we're closed? So of course we have campus safety. So students can call campus safety or they can call 911. We have a local urgent care that's about a mile and a half up the street, so it's not too far. We also have 2 local emergency rooms, very highly rated. And then we also have a 24/7 on-demand telehealth service called 7C Health. Literally, they just go to their web browser and type in 7c.health, and they can sign in. And the first time they have to create like a profile, but after that they can sign in and they can have on-demand visits. The trends that we've seen recently have been somewhere between 5 to 10 minutes for students to get connected with a medical provider, as well as with a mental health provider. So if they need counseling, they're upset, they're anxious, if they just want to talk to someone, they can have mental health visits as well as medical visits. This year now, 7C Health is now also going to be offering scheduled medical and scheduled counseling visits as well. So if students like their provider that they spoke with, they want to do a follow-up with them in a few days or make an appointment ahead of time based on their class schedule, they're certainly able to do that as well. So just in summary, we want our students to start becoming more aware of their health and to seek out care when they need it, to be engaged in their own healthcare. And if they're not feeling better at any time, certainly reach back out to us and come back and see us. And that's just a picture of our staff and our facilities. I think that's it. So I'll stop there. And yeah, I think we still have plenty of time. I know we have a half-hour session, so I tried to keep it concise. Sandy, anything you want to add to student health services there?
I think just to, reiterate the partnership that we have, by contacting Campus C, students can also ask to speak to the Dean on call. And we work very closely with the contact tracers and student health services to activate, any immediate support needed for isolation, support needed for quarantine or modified quarantine for students, and also the wraparound follow-up care support as well. So definitely a partnership that we're very grateful for, and we do want to be mindful of our time, and we'll let Jill lead us off, and any questions that folks may have that we can help answer.
Okay. Okay, so we do have a couple of questions, and I want to say the first one, are these services available to students who have health insurance outside of Pitzer?
Yes, yeah, all students, regardless of what insurance they have, can come to student health services to get care. That's a great question. So yeah, it does not matter. They don't have to have the student health insurance. So that's a very common misnomer. Though I don't have the student health insurance, so I can't go to student health. That is absolutely not true. Any student can come in and see us.
Great. Okay, and the second question I see is, what HIPAA release documents and/or power of attorney are required for release of medical reports to parents?
Yeah, so students' records, like I said, are considered confidential. It's more of a FERPA requirement. So educational records are considered part of FERPA. And so there is that confidentiality. So you want your students to be able to feel comfortable to come and seek care, and not worry that their parents are going to find out. We want them to be able to access care when they want it. However, on the chance that you and your student are doing a shared decision making, and your student does want to share their record with you, we do have forms, and I'll put a link into the chat where these forms can be located. So there's a link there for student help to another provider, and in parentheses we do have written that if they want to share their records with a parent, or different your doctor back home or something like that, so you would use that form. And there's another link there for the medical provider to student health. So if you're a doctor in your local town, has something pertinent to your student's health history they want to share with us, there's a release of information that they can fill out so that we can get those records as well. So both ways, the documents will be there at that link.
Great. Okay. How about prescriptions? Can prescriptions be filled on campus? For example, the pill or Focalin?
Take a look. So yeah, so like I said, we have a dispensary with some very kind of common, like your antibiotics, some common birth control, and those types of medications. We do have some like rash and itch creams, and so we have a variety of kind of very commonly prescribed medications at a fairly reasonable cost. So those your students can get on campus within student health before they leave. Any other prescriptions that we don't carry will be sent to a local pharmacy, or if a student prefers not to get it from our dispensary, just wants to get it from their local pharmacy, we can always send it there. So we have Hendricks Pharmacy in the village that's within walking distance. So for folks who are not familiar with Claremont, you want to go ahead and kind of look up or Google Hendricks Pharmacy. And then I think we also have a Vaughn's Pharmacy, I think CVS, and so, several of the major pharmacies are also nearby, but Hendricks would be the closest pharmacy to us. Is there any other pharmacies your students usually use, Sandy?
No, I think that's the closest one.
Yeah. So yeah, so we don't carry any controlled substances on site. So Focalin or those kind of medications would not be something that we would carry on site. So those prescriptions are actually done through psychiatry, not through student health. So we have MCAPS, which is Montour Counseling and Psychiatry Services. So you'd have to get established, your student would have to get established with them and get their prescription from there. And then those prescriptions will be filled locally in a community pharmacy.
Excellent. The next question is about mental health services, which I do want to note. We have one of the therapists from Monsoor speaking tomorrow morning. Fiona Fike will be here. But the question is about, is it provided via the health center or via another source? So I don't know if you want to say how you perhaps partner with Monsoor.
Correct. Yeah, I mean, that's a great question. So we're both located in the same building. We do partner. We're part of the same umbrella of student services. And we do partner. So there are students who won't know and they'll come to us or they'll just be tired or something. As we talk to them, we figure out that they may be suffering from depression or stress or anxiety or something else that's manifesting as their headache or neck ache, etc. And we will partner really well. We'll walk them over to Monsoor and kind of do a handoff. And similarly, Monsoor may see somebody who's suffering and they may want to say like, hey, maybe you have anemia or thyroid issues or something. We want you to get checked out. So we do partner really well with Monsoor Counseling and Psychological Services. They are right across the hallway from us. So they're in that same building that I showed you, the Student Health Tranquilita building. Yeah, so it's available, it's on campus, and Fiona tomorrow will be able to provide a better overview of exactly what is and what isn't covered in their umbrella there.
I just want to note, as Dr. Jindal mentioned earlier, that 7C.health is also a 24/7 resource, and they also communicate and liaise with Monsoor Counseling and Psychological Services, but also with our 24/7 on-call team if there is any incident involving high levels of crisis or distress, that our team is also here on the ground to be able to provide support and care to students. And I'm going to put in the chat here, some of you might have attended a session earlier where Assistant Dean and Case Manager Stephanie Hannett just shared the website for her mental health and wellness support, and she liaises closely here at Pitzer with Monsoor.
And specifically because we know there is a lot of mental health needs, and especially with the pandemic and everybody kind of coming back from the pandemic, Monsoor, in addition to their in-person, on-site counseling and the 7C Health that's 24/7, Sandy mentioned, they also have an after-hour call service called Protocol. So there are plenty of resources, so whatever your student feels comfortable with, along with all the support staff that Pitzer has on site, in the res halls and with the on-call folks to really support your student.
Yes. And I would affirm that when I was in student affairs, I really wanted students to understand that these services belong to them now already. They are their services, so they're able to have access to them. Sometimes folks assume that that might not be for them. So yeah, it is important, and especially in the pandemic, to really help them understand that these are their services right now. They possess them in a sense. I want to see if other folks have any other questions, or if there are certain questions, Sandy and Dr. Jindal, that you have heard that you want to touch on.
I think you guys already had a COVID related session this morning, which I was not able to attend. I had a conflict with another meeting, but certainly if there's any protocol questions or anything like that, I work closely with Sandy and her team. Pretty much every day we're in touch to see what's going on and what's happening across the campuses. The benefit of having student health be a centralized service is we kind of have an oversight view of what's happening across all 7 campuses here at Claremont. And so we can help support and identify things that maybe just what's going on one campus may not be able to see. So yeah, if there's any questions about that. Were there any outstanding questions from this morning, Sandy, that?
No, I think we were able to cover all of them. But, we had larger participation numbers earlier today. So, unless any other questions emerge, we're completely open to staying on.
Dr. Jindal, can you say a little bit more about what it's like to work with the 7 Cs as far as just having your oversight and working, we see our part, but you see the whole picture.
Yeah, so the advantage of the consortium of the 7 Cs is you got 7 times the brain power, right? So sometimes, we're talking about how do we approach this thing with COVID, and you get that much more input, and there's always somebody with a better idea, right? So we are able to kind of coalesce all those ideas together to really create best policy for students at each campus. So I think that's one advantage that we have. We hold, we had been holding daily calls with members of every single campus back when the pandemic first started. Then we backed off on the frequency, and as the students are coming back, we're holding more frequent calls every week, at least 2-3 times a week, to really kind of, what's going on this campus, what's going on that campus, and really making sure everybody's aware, our policies align as much as possible across the campuses, while still trying to maintain each campus's independence and culture and that. So yes, that's really a kind of the unique structure of the Claremont that certainly has its advantages that Pitzer students will enjoy here. Student health, yeah, we are the central place for everyone's healthcare. So we do kind of we're able to see trends. We're able to talk to students. It helps us with our contact tracing because it's not in silos. So we're able to find out if this student was hanging out with a student at a different campus and really kind of make those connections. So even if your Pitzer student is, connected to a Pomona student or a CMC student or a Harvey Mudd student, and they were at a gathering together, they shared a class together, they went to lunch together, we're able to kind of suss all that out and really provide overall care rather than care in silos.
Well, thank you so much for this. I appreciate, we are so grateful for you being here today and telling us a little bit about yourself. I know that folks, if they think of a question, once our session ends, they can reach out to either of you to follow up on their question. And again, to know that the Pathway Forward website is updated daily and has a lot of information on it. So it really is the starting point for our families with questions about the Pathway Forward. So I think with that, I just want to say thank you to both of you and to the audience for coming to hear a little bit more about student health. And we look forward to a great year with you.
Same here. Thank you, everyone. Bye-bye.
Great. Okay.